At 13 years old, Brandon is at Erickson's stage of identity versus role confusion. At this stage, an adolescent must struggle to discover and find his or her own identity while negotiating and struggling with social interactions.
Brandon, what are you doing? Get off the phone. Brandon, are you listening to me?
Mom, what do you want? You're always trying to ruin my life.
What did I do?
At 13 years old, Brandon can begin to use formal operational thought and can think about the future, the abstract, and the hypothetical.
How is it going today? How are you guys doing? So we got your lab results. With the blood in the stool, it's a little bit of a concern. The test results weren't indicative exactly of what it is, so we want to go ahead and do another procedure called a colon x-ray. We're going to schedule for the colon x-ray in about 2 days. It'll give you some time to prep and get ready.
In addition to the ability to perform abstract mental operations, teens become more scientific and logical in the way they approach problems. Speak to them logically, but clearly. Explain the procedure scientifically, but to their level.
It's a fairly simple procedure. Basically, we're going to be taking some pictures of the inside of his stomach and his intestine to see what's going on. So the day of the procedure, we are going to ask you to go ahead and be on a clear liquid diet. And basically all that means is you're not going to be eating anything, and you're going to basically just stick to foods that are clear. So things like Jell-O, you could do chicken broth, you could also do teas, anything that you know is clear. Water is great. And then that night you're not going to eat anything that night. You're not going to drink or eat anything after 11 p.m. And the other thing is we're going to actually have to go ahead and send you home with a laxative kit. Basically, we need to get everything cleared out so that when we take the pictures, we can see see a little bit better. And if we have stuff in there, you can't see as well. So we're gonna have to clear you out. But I'll have my nurse come in, and she'll explain exactly what you guys got to do the night before with the enema. She'll give you some information, some pamphlets for you to take home, and really, explain to you what you have to do, so you don't have to be worried. And then, if you guys want, we can give you a little bit of a tour, show you where the procedure is going to take place. So you can get a little bit more familiar with it and not be so intimidated. Okay? Do you guys have any other questions for me?
No.
Okay. So if you don't have any other questions, I'm going to introduce you to our nurse. Her name's Cher. She's going to walk you through how to use enema, give you a little more information, and she'll actually be the one taking you down and giving you the tour of where the procedure will happen. Okay? All right. It was nice meeting you. Good luck.
Thank you, doctor.
Thanks.
Patient teaching for adolescents should take the form of guidance rather than lecturing. Although nurses may still include the family in education, adolescents themselves are the major focus of teaching since they have considerable independence.
It actually gives you a lot of do's and don'ts as far as what type of food that you can eat, what type you can't. It's mainly all liquid, mainly all clear. So it's really important to do 1 to 2 days before. So we're doing the procedure in 2 days. It's just really important that you stick to that clear liquid diet. And then the night before, no food after 11 p.m. Very important. Another thing that's very important, I know this can be a little intimidating, it's called an enema. She explained to you before, we need to get everything cleared out.
Enema.
An enema basically is just it goes into your rectum. And
I really have to do this?
the thing is that
I'm going
in
to do
order,
it for you, okay?
No, you are not, Mom.
well, what
No,
we'll
you're
do
not.
is I'll explain it to you guys and we can sort of work out the details in a little bit, okay? I know it's a lot to take in, so.
In preparation for teaching both the child and parent, the nurse should assess the quality of the relationship between parent and child.
So I'm going to go over it with you, but you can always refer back to this or you can give us a call if you have questions. But what they're going to have you do is on there, it shows different positions that you can be laying on, but you want to lay on your left side. And you're going to take this bottle, remove the cap, it's pre-lubricated, so you don't even have to worry.
That whole thing goes up?
Yeah, what you're going to do is you're going to squeeze gently. Once it's inserted into your rectum, you're going to squeeze gently
Does
until...
she have to be here right now for this?
Well, right now, we can still talk about any questions that you have. We can definitely talk about privately in a minute. I'd just like to
You
show
don't
you
have to
guys...
be embarrassed,
Oh my
Brandon.
god, whatever, Mom.
I know it's a lot to take in right
I'm
now.
sure you're enjoying this. Anyways.
Well,
I need
what
to
I'll
know
do is,
this.
we can, I definitely want to let your mom know what's going on, but I have no problem. We can go ahead and talk about any questions you have after. We'll have your mom step out and talk to the doctor, and we can,
Alright.
any questions you have, we can talk about now or
Just
later.
Get this over with, I guess.
Okay, so, and since this procedure is meant to clear out everything before the actual procedure, it's really important that you stay near a bathroom and don't leave the solution in for more than 10 minutes. Usually 1 to 5 minutes is a good amount. Like I said, everything's on this paper, so if you have any questions. Do you guys have any questions?
No, but I really don't want you to do this.
Or maybe your dad can help you with
Alright,
this,
because
okay?
you certainly won't be helping me with this.
Alright, you guys want to see a tour of where everything's going to be happening? So we can sort of show you. Here's the procedure room. You guys remember Dr. Stephanie? She's actually going to be explaining to you everything that's going to go down. I'm going to come back in a few minutes and we'll review with any questions that you guys have. Sound good?
Sounds
Thank you.
good.
Okay, so basically what's going to happen is on the day of, you're going to check in at the front room of the GI. They're going to have you, Mom, you're going to actually stay in the waiting room and we'll have Brandon come back in here and we'll get him set up. You'll be lying on this table. Basically, I know Cher explained what an enema is. Basically, you're going to have another enema.
Oh, that's wonderful.
This one is with a liquid called barium, and basically it helps us when we take the pictures of your, your insides and your intestine. Basically, it helps us see what's going on through contrast. So basically, we can see what's actually. If not, it would just be black.
Okay.
So basically, again, you'll be laying down. We'll be having you move from side to side, asking you to change positions as we take different pictures in different spots. And then with that, hopefully, we'll be able to give you a better diagnosis of what's going on. Do you guys have any questions?
Is anybody gonna know about this? Like anyone at school or anything?
No, everything we do in here is going to be 100%
Alright.
confidential. No one will know. This is very
You better
private
not say
matter.
anything. Serious, in front of my friends when they're over.
Are you embarrassed about it?
There's
Oh,
nothing,
yeah,
nothing to
whatever,
be
Mom.
embarrassed. Basically, this is a really routine procedure. A lot of people have it, and you don't need to be scared. If you have any questions about anything that we're doing while we're doing it, you can always ask questions. Don't be afraid to say what's going on or what are you doing or what's this for. And we would definitely be willing to answer any questions you have. Okay?
Thank you.
Okay, thank you, doctor.
Okay.
Nurses must respect the patient's privacy. This is critical in establishing an atmosphere of openness and trust. The nurse is in a good position to dispel any misconception of a young patient.
So, it's a lot of information to take in at once. Do you have any questions for me?
How long will this last for? Am I just, everything's just gonna be flowing out? Will I be able to hold anything in anymore?
It's not a permanent thing. It's just going to be after the procedure. It's going to be, we're going to have you near a bathroom and, for a couple days.
Can I go back to playing basketball and football?
Absolutely. This is just something that we're just trying to figure out. It's going to take us a couple days, and then about 3 to 5 days after that, we'll have your results. But yes, once everything gets cleared out, then you can start playing basketball.
But I'm not gonna just all of a sudden just poop in my pants on the court, am I?
No. But like I said, after the procedure, you want to take it easy for a couple days just to make sure everything comes out. But then after that, everything's
Okay.
whoever. So we're going to get the results in 3 to 5 days. We also have this iPad here. It has a bunch of pictures and videos to sort of explain the procedure a little bit better.
Mm-hmm.
Do you have any other questions?
This is kind of graphic, though. So it's gonna be up me?
Parents, however, will still decide the treatment recommendations for the patient. Therefore, the nurse conducting patient care must establish a relationship not only with the patient, but with the parent as well.
Really typical. He's 13. This can be a little bit of an embarrassing procedure. I understand the area is a little bit of a sensitive area, especially, with the boys, But I think as long as you are supportive and you are there for him, as long as you come in calm, I think he's going to pick up on that. You're calm, you're okay with the procedure. I think he's going to take cues from you, and as long as you're calm, he'll stay calm.
Okay, I will try.
What's going to happen is he's going to lie down for the dogs.
Look at me.
Alright, so we're going to get the results in 3 to 5 days.
Brandon, get off the phone.
No. Cut.